Ashton. We're going to be doing your physical assessment today. I'm just going to let you know everything is confidential and you have the right to refuse anything, okay? I'm going to go wash my hands and then we'll get started. Can you see your armband? Can you tell me your name and date of birth?
Molly Tipton, March 28, 2005.
Okay, and then I'm going to ask you 3 questions. What year is it?
2025.
Where are we?
Martin Hall.
And then, what's your name again?
Molly Tipton.
Okay. Patient is alert, awake, and oriented times 3. Okay, we're going to go ahead and go do our Snellen chart, okay?
Okay.
We'll go back there. Okay, with both your eyes open, can you read the smallest line?
So, I can read the one above.
This one?
TFC.
Can you read that one?
LPED.
This one?
PECFD.
And can you read this one?
EDFCCP.
Can you go anywhere?
Good. So right reflex is noted in your eyes.
FELOPZD.
And so now we're going to go a little closer.
No.
Both eyes are at 2025. Cover your left eye. And then read the lowest one.
LEFODFCT.
So I want you to cover your right eye and read the lowest line on the chart.
Okay,
that you can
for the right
focus.
eye patient is
So in both eyes we noted a
Cover your right eye.
optic disc,
LEFODPCT.
and then noted blood vessels leading to the optic disc.
Right
And then
patient
cover the
is
other eye. I want you to do the same thing, but I want you to read it from.
Let's go right to the examination room. The patient's gait is normal and the patient follows verbal commands appropriate for her age. I'm going to go ahead and check your eyes and test your pupil size. Pupil size is a 4 bilaterally. Okay, I'm going to test your light reflex. I would normally dim the lights, but we cannot in this room. Test for constriction. Okay, eyes constrict. Okay, I'm gonna have you look at the top of this pen light and follow. Go side to side. Okay, pupils are equal, round, reactive to light, and follow accommodation. Look at your ears. I see no lesions, no scars. I see 3 piercings. Skin is appropriate for ethnicity. Okay, in the right ear, there's also 3 piercings. No scars, no lesions. Skin is appropriate for ethnicity. Okay, I'm gonna look in your nose if you can lift up. Turbinates are present. There's a pink and moist nose. Okay, I'm gonna have you open your mouth. Teeth are white, clean, no cavities. Buccal mucosa is pink and moist. The top of the mouth is pink and moist. Can you stick your tongue up to the top of the roof? Okay, the bottom palate is soft and moist. Can you lift up or put on your bottom gums? Bottom gums are pink and moist, no scars, no lesions. Okay, can you do your top lip? Okay, gums are pink and moist, no scars, no lesions. Can you open your mouth again? Okay, tongue is symmetric. Can you stick out your tongue and say ah, ah? Uvula goes up on pronation, and tonsils are present, and they are going to be rated a 1. Okay. Ears are symmetrical. They are symmetrical to the outer canthus. Okay, no scars, no lesions on the face. Skin is appropriate for ethnicity. Would you like your gag reflex done?
Mm-mm.
Okay, if I were to do the gag reflex, I would get a tongue depressor or a cotton swab. Push the tongue down and test the gag reflex. Okay. We're gonna do your posterior breast sounds. So now if you stand, pull this back. I'm gonna inspect the back. Skin is normal. No, I see no moles, no scars, no lesions. Skin is appropriate for ethnicity. If you'll just take a deep breath. Okay, the chest rises and falls symmetrically. Okay, I'm gonna palpate and just tell me if you feel any tenderness, okay? You feel any tenderness? Okay. I'm gonna listen to your breath sounds in a louder motion. Okay, every single time I move the diaphragm, just take a deep breath in and out, okay? Okay, breath sounds are even and unlabored. Okay, I'm gonna have you sit down. Okay, I'm gonna inspect your neck, okay? I'm gonna look for any pulsations. There's no scars, no lesions. The skin's appropriate for the ethnicity. Okay, I'm gonna feel your pulse, your carotid pulse. Okay, left carotid is a 2+. And right carotid is a 2+. Okay, I'm gonna listen for any bruise with the bell of my stethoscope. Just hold your breath whenever I put it up to your carotid, okay? Okay, no bruise were heard in the neck, carotid area. Okay, now I'm gonna move down to your chest, okay? If you will lay back for me. Okay, I'm gonna lift up your gown. Now I'm gonna inspect the chest. There's no scars, no lesions, no moles. The skin is appropriate. I'm looking at the chest rise and fall, and it is symmetric. Okay, I'm gonna go ahead and palpate. Have you had any tenderness in your chest area? Okay. Just tell me if you feel any tenderness. Any tenderness felt? Okay. I'm gonna listen to your breath sounds in a louder motion. Just take a deep breath in and out. Okay, there's no unlabored breathing and breath sounds are heard all over. Okay, now I'm gonna listen to your aortic, pulmonic, tricuspid, and aortic valves, okay? Just take a breath every single time I move the stethoscope. Okay, S1 and S2 are heard in all points of the heart. Now I'm gonna go back up with the bell of my stethoscope. Just take a deep breath in and out. Okay, no murmurs were heard in the aortic, pulmonic, tricuspid, or mitral valves. Now I'm going to feel over the aortic valve. I'm gonna listen to it. Okay, the apical pulse is going to be a 72. Now I'm going to count the respirations. Okay, respirations are at 13. Okay, I'm done with your chest. I'm gonna pull this down. Okay, I'm gonna move to your abdomen now. Okay, have you had any tenderness lately? Okay, I'm gonna listen first, okay? I'm gonna start in the right lower quadrant. Okay, vowel sounds are normoactive in all quadrants. Okay, I'm going to palpate, okay? Just let me know if you feel any tenderness. Again, I'm starting in the right lower quadrant. Any tenderness? The belly is round. I see no pulsations. The umbilicus, there's no hernia present. The skin color is normal, no scars, no lesions. Okay, I'm gonna cover you up. And we're gonna go ahead and go to your legs, okay? Do you want me to do the femoral pulse? Okay, if I were, I would palpate and find the pulse in the groin area and rate it, and a normal would be a 2+. Okay, I'm gonna take this out. Okay, first I'm gonna lift this up and look at your hair distribution. Hair distribution is normal. I'm gonna test for edema. I'm gonna go right below the tibia. No edema is present. Okay, I'm gonna check your pulses now. Check your popliteal. Popliteal is a 2+ in the left leg. And popliteal is a 2+ in the right leg. Okay, I'm gonna move down. Can I take your socks off? Okay, I'm gonna check the posterior tibial pulse. Okay, 2+ in the left. And a 2+ in the right. Now I'm gonna check the dorsalis pedis. Okay, dorsalis pedis is 2+ in the left. And 2+ in the right. Okay, we're gonna do some range of motion exercises on your lower extremities, okay? Can you flex your leg up towards your belly and then extend it back out and do the same with your right. Okay, range of motion for the right and left leg are 5 out of 5. Okay, can you adduct this way and then adduct this leg? Okay, abduction and adduction is a 5 out of 5 for the left and right leg. Can you do your ankles around? Okay, range of motion in the left ankle and the right ankle is a 5 out of 5. Can you spread your toes and wiggle them? Okay, range of motion is 5 out of 5 in the toes. I'm gonna look between. I see no dry skin. Looks normal for ethnicity. Nothing abnormal. I'm also gonna look at the soles of the feet. There's nothing abnormal. There's a little mole on the left sole of the foot. Okay, I'm gonna have you come to the edge of the bed. Okay, can you hold out your arms for me like this? I'm gonna check your brachial pulses. Okay, brachial pulse is a 2+ in the left and the right brachial. Check your radial. Radial's a 2+ in the left. And radial is a 2+ in the right. Can you extend and flex your arms for me? Okay, good. Can you move your wrists in circles? Good. Can you put your fingers out, spread them out, move them? Good. Okay. Range of motion is 5 out of 5 in the fingers, wrists and arms. Now I'm going to do your shoulders, okay? Whenever I push down, I want you to resist, okay? Okay. Range of motion is a 5 out of 5 in the shoulders. Okay, I'm gonna check here. Can you push up against here? Can you push up against me? Good. Okay, can you pull against me? Good. And I'm gonna push. Good. And same for this leg. Okay, same. Okay. Range of motion is a 5 out of 5 in the legs. Okay, now I'm gonna have you stand and we're gonna look at your back motion and then I'm gonna check for scoliosis, okay?
Okay.
Okay. Scapula is symmetric. I'm gonna have you raise your arms to the top of your head and then bend over and touch your toes. Okay. It's intact, symmetrical, no S curve, so no scoliosis is noted, so I'm gonna grade it a 0. Okay, you can stand up for me. And turn back towards me. Okay, I'm gonna have you raise your arms, go side, side, front, back. And touch your toes again. Okay, good. Okay, you can have a seat. And I think that's it.